Everybody, we've got another heart today. This is number 212 in our collection. The heart would have sat in the chest roughly like this. Anterior surface coming out towards the screen, the posterior surface towards the turntable, left over here, right over here, superior head here, inferior legs here. So let's start off as we usually do, which is by locating what appears to be the right atrial appendage, at least externally. And here we find an appendage that looks triangular, broad-based, or pyramidal in shape. And we can see evidence of some previous operations here. So let's go ahead and open up the heart here and take a look. And immediately we find a few things. We do find pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. And then immediately we also see that there is some sort of a baffle here, baffling something into the right-sided atrium. If we'll try to follow this baffle in a little bit. But first, let's locate some of the other structures in the right atrium. Here is the mouth of the coronary sinus. You can see it's quite large. Here is the tendon of Totaro. And whenever we come across a coronary sinus and the tendon of Totaro, obviously we must think about the triangle of Koch, which is bounded by the coronary sinus, the tendon of Totaro, as well as the right-sided AV junction. And at its apex, which would be approximately here in this heart, is where we would expect to find the atrioventricular node. So we'd expect the AV node in this heart to sit roughly here. When we look at this right-sided atrioventricular junction, we do find that it is guarded by a valve with 3 leaflets. 1, 2, 3. We do find that there are septal attachments of this valve, all consistent with the morphologic tricuspid valve. We see that the ventricle it enters into does appear to have coarse trabeculations consistent with a morphologic right ventricle. And we do find the septomarginal trabeculation as well. And what we also see, kind of hidden back here, is a ventricular septal defect, which does appear to be a central perimembranous defect. And you can see the tricuspid valve does seem to course through this defect. And we'll look at it from the left real quick. There is tricuspid and mitral continuity, so a central perimembranous defect, which also appears to extend into the inlet a little bit as well. So a central perimembranous VSD with inlet extension. Now when we get to the right-sided outflow tract, we find a semilunar valve, an arterial valve here that does appear to have 3 leaflets, 1, 2, 3, and there are 3 sinuses. And it's important to remember whenever we're talking about the semilunar valves or the arterial valves that there isn't a true round or oval annulus. The annulus here is actually kind of this crown shape appearance, because interposing between the fibrous valvar leaflets are actually these triangles of muscle. This valve is entirely supported by muscle. Now, when we take a peek at the great vessel, we actually find, or the sinuses rather, of this arterial valve, we do find an orifice to the coronary artery here. And we find another one back here. So this appears to actually be an aorta, giving rise to both the coronary arteries. So this is the aortic valve, and this appears to be the aorta. So it appears that we're dealing with a heart with transposition, which gives us some insight to what the baffle and the atrium might be. So why don't we go ahead and look at the posterior aspect of the heart. And when we do that, we find that there is some sort of a baffle that appears to lead into the left atrium. So why don't we go ahead and open up the left atrium if we can. And when we do that, we do find a smooth-walled atrium, although a lot of the atrial wall here also has baffle material. But a morphologic left atrium, and it appears that the baffle we saw from the right is in fact right here and seems to be routing the right pulmonary veins to the right-sided atrium. So there is a pulmonary venous baffle for what appears to be the right-sided pulmonary veins. And there is a conduit that appears to go to the left atrial appendage, which likely routed inferior caval vein blood flow to the left atrial appendage and the left atrium, all consistent with what is a Baffe procedure. And in the Baffe procedure, the inferior caval vein blood flow was baffled over to the left atrium. The right pulmonary veins were baffled over to the right atrium. Let me just make sure I said that right. The inferior caval vein blood flow baffled to the left atrium, and the right pulmonary venous flow baffled to the right atrium to help partially correct transposition and relieve some of the hypoxemia that results from transposition. There is a 2-leaflet valve here. Here's the anterior leaflet and the posterior leaflet of the mitral valve. You can see that there's no direct connections to the septum of this valve, consistent with the mitral valve, and that this ventricle here does have fine crisscross trabeculations, consistent with the morphologic left ventricle. Now, when we open up this outflow tract, we find the mitral valve is in continuity with this arterial valve here, which must be the pulmonary valve. There are no coronary arteries arising from any of these sinuses, and we've already seen the origins of both. And here we've got a 3-leaflet arterial valve, once again, with 3 sinuses, consistent with a morphologic pulmonary valve. And in this valve, you can see that there is pulmonary mitral fibrous continuity, and that the mitral valve also is in continuity with the tricuspid valve through this ventricular septal defect that we saw from the right side already. So there is, in fact, usual arrangement of the atria. There is there are concordant atrioventricular connections, right-handed ventricular topology with a central perimembranous ventricular septal defect with discordant ventricular arterial connections with an aorta that's anterior and rightwards. And a Baffe procedure has been done to this heart, wherein the inferior caval vein is baffled to the left atrial appendage, and the right-sided pulmonary veins are baffled to the right atrium. And so this is transposition with the Baffe procedure.